Things I wish I'd known before I went through risk-reducing double mastectomy. And I want to focus on the specific surgery that I went through, which isn't the conventional surgery in my case. So usually people would be offered to have a reconstruction with implants or fat grafting or an aesthetic flat closure. But I essentially chose a top surgery, double incision, that's the style of what trans people would get when they're transitioning from female to male. So if you get your consultation when you're a carrier of the BRCA gene, this isn't an option that you would be offered. But if you dig a little deeper in your research, you might be offered a Goldilocks procedure, which is a little bit similar to what I've been through. And it's when they are reconstructing a small mound out of the tissue of the spare skin and fat that's left after they remove all of the breast tissue. So the difference between double incision, top surgery, and a Goldilocks procedure is the way they cut it. The protocol is different. So when you see someone that had Goldilocks, the incisions would be this way and then this way towards the nipples. It's very kind of indicative. And then for me, for this double incision top surgery style, the incisions go like this and up here to my armpits. How much the size of your original breast is a factor here. For doing the Goldilocks procedure, you need a pretty big size breasts to make these little mounds, and with this double incision, it doesn't really matter what's the size of your original breast. You can do it either way, but maybe you're gonna be flatter. So I also got to keep my nipples, but they had to move them to a different location, so it makes sense. And they had to cut the areola so that it's proportional to the size of the new chest. And another question is about if it looks more masculine or more feminine. And I have to say that I feel like it's kind of neutral. It doesn't look feminine. Maybe Goldilocks would be more kind of a feminine look to it because of the incision going up where to the direction of the nipples. It kind of makes this triangle shape, and my new chest look flatter, like might be more masculine, but it doesn't look so masculine. I would say it's kind of just neutral, and I'm fine with that, but for some people that would be an issue. How long I'm gonna have to stay with this compression belt? Probably another week or so. So it's gonna be 4 weeks post-surgery, but I heard other people had to wait even 6 weeks before they can remove it. But so far I'm not concerned about that because it kind of gives me this sensation of holding everything together. How is sleeping? Obviously, this is a tough one because I have to sleep on my back still, and I am used to changing position throughout the night from side to back to tummy, and it's making it really hard especially when I wake up in the middle of the night, uncomfortable position, want to change, and I can't change positions. It's hard to fall back to sleep. So I have been taking really small doses of trazodone in the past couple weeks so that it gives it's not a sleeping pill, it's not a sleep aid, but it's kind of a small sedative that gives this just more relaxed night, and I don't have a hard time falling back asleep if I wake up from being so uncomfortable. Hope that answers some of the questions about this double incision, top surgery, preventative, risk-reducing mastectomy that I went through. Feel free to drop another comment with questions, and I'm gonna try to answer as much as I can.